Welcome back to Community Health Heroes. Did you know, according to the Centers for Disease Control and Prevention, opioid use by pregnant women represents a significant public health concern, given the association of opioid exposure and adverse maternal and neonatal outcomes, including preterm labor, stillbirth, neonatal abstinence syndrome, and maternal mortality. With us now are Dr. Kevin Stevens, the Senior National Medical Director of Clinical Services for Optum Population Health Solutions and Prevention, and Emily Stevens, the Director of Care Management at Women's Hospital, to talk about the GRACE program that's geared to help opioid-addicted pregnant women and their newborns. Welcome to the show.
Thanks for having us.
Thank you for having us.
Emily, let me start with you. Tell us about the GRACE program.
GRACE is a care coordination program for pregnant women who are struggling with opioid use. GRACE stands for Guiding Recovery and Creating Empowerment, so we envision it as a network, a place where women can come and be connected to all of the different community services and providers.
And Dr. Stevens, how can this United Health Foundation $1.2 million grant help women addicted to opioids in Louisiana?
So the $1.2 million is really help to get what we call a wraparound service, where we can get the doctors, the nurses, the psychiatrists, the community players, all to help the mother and the child get through this problem.
Can you tell our viewers how big a problem this opioid problem is, specifically for pregnant women in Louisiana? I mean, it's a growing problem.
It is so huge. I mean, over the last, from 2003 to 2013, we had a big increase, like a fourfold increase. Even at Women's Hospital, they have had a 67% increase in their neonatal abstinence syndrome in their patients over a few years.
Emily, it's probably natural that this program started at Women's Hospital because you deliver a lot of babies there, right?
We do. We're actually the largest delivery service and largest NICU in Louisiana.
Wow.
And so recently we've seen an increase in the rate of neonatal abstinence syndrome at our hospital. And so that we knew that we had to do something, and in us doing something that we could really be part of the solution and make an impact for the state.
Dr. Stevens, how are newborns affected by maternal addiction? You mentioned a little about the syndrome. Could you tell us a little more about it?
Neonatal abstinence syndrome, it's when the babies have to withdraw from the opioid addiction from the mother, and so they can have tremors, they can have convulsions, you can have an increase in SIDS, sudden infant death syndrome. So that's why it's so important that we identify these mothers early in the pregnancy, and then that way we can help them have the treatment that they need to minimize the impact on the child.
Well, that sounds horrific, and I know there's also this stigma about being addicted to opioids. How does the GRACE program help women get over that stigma?
So we work with women and teach them that opioid use disorder is a chronic relapsing disease. And then we also work with our hospital staff and our treatment providers also to educate them on that opioid use is a chronic relapsing disease, and to reduce the stigma or the thought that this was a moral failure or a choice by the individual.
How can women in need participate? How do they get started?
Yeah, so they can be referred by their obstetrician, or they can be referred by their primary care doctor or another community agency that they're engaged with, but they can also call themselves and enroll in the program.
How are y'all determining what means success of this program? What benchmarks are you trying to hit, or what are you just seeing already?
We look for a healthy mom and a healthy baby. Like Dr. Stevens was mentioning, we try to get engaged with the woman as early as possible because that has been proven to show positive outcomes for both mom and baby.
And then we look at like NICU, neonatal intensive care admits. We look at birth weights. So we're hopeful that we have increased weights in terms of the birth weight of the infant, as well as decreased days and decreased admissions to the neonatal intensive care unit. And those are some really hard metrics that we can use to follow to see the success of the program.
And I know that the program is still, at its early stages, but I mean, have you seen some hard outcomes already? It's something that you can say, wow, look at the changes we've already been making?
We've only been open for about 6 weeks to 2 months at this point. But we've had a lot of women discuss with us that they felt much more comfortable attending their appointments or engaging in treatment and recovery because they had the support from the program.
It's a greatly needed and badly needed service, so we're just so happy that this is there.
Tell our viewers how they can learn more about the GRACE program.
You can learn more by going to our website. It's womens.org/grace, or you can call 225-924-8574.
when the word gets out, I'm sure more and more people will be coming to and approaching and hopefully be a part of it and hopefully make their lives a lot better.
Yeah, and I just to say that the stigma is really a big problem, and so we tell our listeners that, look, if you have a problem, no problem. Just come in and let us work with you. We all have ups and downs, and so it's not a stigma. So it's a problem we can address, so work with us and we can work with you to address it. So thank you very much for having us here.
Oh, our pleasure. And please come back maybe in a year and tell us about some of those metrics and how many people you've helped.
Sounds great.
Thank you.
Thank you again. When we return, how to find the local help you need to stop smoking and all about the Great American Smokeout. We'll be right back.